I'm Dr. Jeff. So I'm going to show you exercises for spinal hygiene. It is really important to make sure your spine is flexible, to make sure it's lined up properly, and to make sure it's moving properly. Your discs do not have blood supply, and so the only way you can get water and nutrients is by having proper movement. Most people have spinal problems and issues. They have subluxation, so the spine has shifted out of place, and they have decreased disc space, and they have stress on their discs and their spine. So if we can get more motion in there, that can help rehydrate the discs, and that can increase your disc space. We see people all the time, as we start working on their spine and their posture, their disc space increases, so they actually get taller. So we're going to show you exercise for the neck, for the mid back, for the low back, to increase your motion and to increase your flexibility. I want to show you some things you can do to improve your proprioception, which is your balance and equilibrium. Patients that do this, they help to hold their adjustments for longer. So I want you to stand on one leg. Start off like this. I like to have something to hold on to. Try to hold it for 30 seconds, a minute. If that's easy, then hold it like that. If you really want to get technical, close your eyes. Hold that for, again, as long as you can. Do that every day, and that will really help you hold your adjustments for a lot longer. This is a continuation of our balance exercises. Here we are using this disc ball to stand on here like this and try to hold that for as long as you can. We also have a rocker board, so we want you to stand on one leg, try to hold that for as long as you can. And you can also, on the rocker board, you can go forward and backward to work on your proprioceptors. Now you can also stand sideways like this. This one I find a little bit easier. Now, when you're standing on one leg, it's going to cause the muscles to fire on either side of your spine, and that will help get things to be firing better and in a better pattern. All right, so we're going to go over exercises for your core. The first one I want to show you is a high plank. Like you're doing a push-up, you want to have your torso parallel to the ground. I want to go for a minute, but if you're really good and really motivated, go for 2 minutes. This helps strengthen the core, hamstrings, the glutes, and the paraspinal muscles to support your spine. An alternative version, this is called a low plank. Try to hold this for 1 minute to 2 minutes. But we want to do this every day to help get more motion. Right now what we're going to do is what's called a hollow hold. It's going to make the stomach muscle stronger. So get in here like this, arms, legs out, and try to hold that for 30 seconds to a minute. That's going to strengthen the abs in here. Now you can also do reverse crunches, knees to chest. This works the top part of the abs here like this. And if you want to work the lower abs, do leg raises like this. Now, you can hold it for 30 seconds or you can do leg raises like that. So doing all of these exercises is going to help make your core stronger, but you're less likely to have where the spine will go out of alignment. The first one is to stretch the gastrocnemius muscle, keeping your heel on the ground and the back leg straight, and you're trying to get a nice stretch back in the calf here. Next one, you're going to keep your leg back like this. Now bend forward, trying to bring your knee to the ground and keeping your heel on the floor. Hold that for 30 to 60 seconds. That's stretching the soleus to stretch tibialis anterior. Put your foot up against a wall like this, forward into it, and try to go as much as you can. That's going to get a nice stretch in your calf. I'm going to show you a couple awesome ways to stretch your quads. Okay? Put your leg up on the bed like this and lean backwards. You get a nice stretch in here, go to the point of discomfort and hold that for 30 to 60 seconds. If you bring your leg forward like this, that's going to stretch the psoas, which is right up here, and it gets really tight on us. So the first one is just a normal hurdler stretch. Get in here like this, lean forward. As you're stretching, rub the back of your leg. That will help activate that and lean forward. Try not to get a bend in your leg. If you turn your leg out like this, that's going to get a nice stretch on the outer part of the leg. Turn it in. That's going to get a stretch on the inner adductor part. Hold that for 30 to 60 seconds each pose, and that's a good way to loosen up your hamstrings. What I like to do is called the bow forward like this. Keep your legs straight and just bend with your hips and hold that. If your hip is feeling stiff or tight, I want you to get in here and do this 90-90 stretch. So get your front leg in here, 90 degrees, back leg at 90. Get as you're stretching this hip. Count of 5 to 10, relax, and go back, count of 5 to 10. And then you can also turn your body like this to stretch it as well. And hold that for a count of like 5 to 10 seconds, and repeat that 4 or 5 times. Exercise that I like to do to get range of motion. You can do this without the exercise ball. Hold your hands out like this and just swing all the way to the left, all the way to the right. The arms and hands will help create momentum. and then you can bend to the left and bend to the right. Our goal is to help get as much motion in here as we can. We do exercise balls for the mid-back. Rotate to the left, rotate to the right. This is exercises with an exercise ball. We want to do this 50 or 60 times in each direction, and it will really help get more motion in the mid-back, low back area. And if we can get more motion, that's going to help the discs become healthier. I want to show you some things that you can do to strengthen your back so we'll be a lot stronger. This is Cobra. This is an awesome stretch to get extension in your low back. Hold this for 20 to 30 seconds. Help stretch the low back and put it back in extension. It's called Angry Cat. Things a deflection. So you're trying to get as much bend in your back as possible for 20 to 30 seconds. This is Superman. So what you want to do is lift your arms and legs off the ground. You're going to do that for 20 to 30 seconds. If you don't like doing that, you can do repetitions. Up, down, like that. Do that 20 or 30 times. Another exercise we want to do to strengthen the low back muscles is dead bug. Like this, and you can hold that for 15 to 20 seconds. Both sides. This will really help strengthen these muscles here. Or you can do repetitions like this. That is dead bug. Knee to chest. So you want to bring your left knee to left shoulder. Hold it up like this. This is stretching glute max right in here. You want to hold this for 30 to 60 seconds. And when you're doing this, I want you to breathe in, just breathe out. It's important to get oxygen into your muscles. That'll help oxygenate your tissues. Go across like this. This is knee to chest. Opposite side, this stretches the piriformis muscle. Hold that 30 to 60 seconds. And then go across like this. This is called the pretzel. Going to the right, you want to have the upper left body going to the left and the lower body going to the right. This stretches the erector spinae right in here. Again, hold that for 30 to 60 seconds. Hey there, I want to show you how you can use a lacrosse ball to really get rid of that pain and that tightness and stiffness in your neck. So use this up against the wall like this. Oh, that feels awesome. That can really get in and break up those tight muscles. Now hold it for like 3 or 4 seconds in each spot, roll it around. I love the consistency of the lacrosse ball. It really helps. An alternate way to do it, get in here and just lie on it, and that will really help break up the tight spots. So what we are trying to do is pull the shoulders back and pull the head back. So get in here in a doorway, lean forward like this, and I want you to hold this for 30 to 60 seconds. Breathe in while you're doing that. Most people get where their head goes forward, their shoulders are going forward, so this is going to counteract that. You can also do it in a corner like this. You'll love that. That feels awesome. I call that the doorway stretch, the corner stretch. Now what I want to do is show you how to do repetitive cervical traction. This is going to help restore the curve in the neck. It's going to open up the space between the bones. So what you do, put your feet shoulder width apart, turn it slightly at a 45-degree angle, and you do little mini squats. So go down about 1/2 inch to 1 inch, hold for a count of 1 to 2, and then go up, and then down, up, down, hold for count of 2, up for 2, down for 2. So that is repetitive cervical traction. I want to show you some stretches for the neck. I like to use these TheraBands to help get more motion and just so we can passively stretch things. When you passively stretch, it makes a huge difference. So to stretch in forward flexion, bend your head forward like this, hold the band like this, and hold this position for 30 to 60 seconds. Now to go back in extension, we don't use the band. Just push on the bottom part of your chin. Make sure you're not pushing on your jaw too hard and hold that for 30 to 60 seconds. It's really important to breathe in while you're doing this. Then we've got rotation. Grab your band, rotate your head to right like this and hold that for 30 to 60 seconds. You're gonna get a nice stretch in here in the SCM and the scalenes, and then do the same thing on the opposite side. Hold that for 30 to 60 seconds. That's rotation. And then we've got lateral flexion like this, lateral flexion this way. That's how we stretch the neck for flexibility. Again, 30 to 60 seconds you want to hold that for. I'm showing you how to use the wobble chair. The wobble chair is a great piece of equipment that's going to help get motion in the low back, and we want to get motion to restore the normal motion, normal alignment, and that's going to help increase the disc space. Like you're in a hula hoop, so put your hips all the way forward, all the way back. I want to do that 50 or 60 times going forward, 50 or 60 times going backwards. Once you do that motion, then do the same thing to the sides, all the way to the left, and then all the way to the right. Do that 50 or 60 times. The wobble motion, think of it like a figure eight. So you want to have the figure eight tipped on its side. And so what we do like this is we go left hip forward, left hip back, right hip forward, right hip back. Now this motion simulates the normal walking cycle. So the left side of the body is going forward, the right is going back, and it kind of sways and pivots. As you do this, it's going to help to get everything working and firing right, and that will help increase the disc space. So when you go forward, I want you to breathe in, breathe out when you go backwards. So again, right hip forward, right hip back, left hip forward, left hip back.